Hi, I'm Dr. David Hill, and today we're going to talk about how to identify food allergies in children. Now, people get very concerned about food allergies in children, and for good reason. Some food allergies can be very severe, even life-threatening. The way that food allergies present changes as the child grows. So the earliest food allergy you may notice in an infant is a milk protein allergy. Now this may occur in a child who's on a milk protein formula, such as Enfamil or Similac, or it may simply occur in a purely breastfed child whose mother enjoys dairy products, milk, cheese, ice cream, whatever. Even mom eating those products may provide enough of the antigen in the breast milk to cause a reaction. What is this reaction? Well, usually it's stomach upset, sometimes vomiting, often diarrhea, sometimes diarrhea that has blood in it, not infrequently. Really severe cases of milk protein allergy can even look like severe infections in children. They may become very, very ill. Obviously, if your child is having symptoms that make you worried he has a severe infection or is having severe diarrhea with blood in it, you're going to seek care from a doctor, and your child's doctor will help you figure out if it's what the child's eating that's doing it. Now, as the child ages, allergies can present in some other ways. Sometimes you'll see hives. When you see these hives, the big red itchy bumps on the skin, you may be able to associate it with the food that the child has just eaten, or you may not. About 80% of the time, we never know what caused hives. But sometimes you say, hey, he had this last time he ate strawberries. I just gave him strawberries again. I know what these are. It's strawberries. That's kind of obvious. So you might keep a food diary to see if there's a cause. Now, some foods can contribute to other allergy symptoms, such as wheezing or shortness of breath. That's very dangerous when that happens, so you want to make sure you take careful note of what the child ate and report that to the doctor, especially if it's a recurrent process. Some foods just cause a little bit of swelling around the lips and mouth and some itching. If the child is swallowing easy and breathing easily, that's not really a dangerous allergy, and it's something they're likely to grow out of. Now, one thing that people forget when they think about allergies is that something the child has been exposed to many times in the past can still cause an allergic reaction. People always come in to me and say, well, you know, I haven't given him anything new. It's not that you haven't given him anything new. It may be that something old is now causing an allergy. Often you get allergies from repeated exposure. The things we worry about the most are peanuts and tree nuts. Those cause the most frequent, most dangerous allergy involving breathing and the airway. So if you think your child might have a peanut or other nut allergy, be sure and seek care from a physician, because you're going to want an emergency allergy plan if that child gets exposed again. Talking about how to diagnose food allergies in children, I am Dr. David Hill.